So do you know what EKG stands for?
Electrocardiogram.
Yeah, cardiogram. Also could be called ECG, but we use EKG more. What is it? What's it measuring? What's the test for? Yeah, so it looks at the electrical conduction of your heart. Pretty frequent in the hospital, especially on the cardiac floor with a lot of patients like that. The main thing they want you to know is patient teaching. So like, let's see. What would you teach the patient? Like if you were a patient and I was going to tell you that you need an electrocardiogram, some people get like a little scared, like they're getting electrocuted or not. So some main things you want to tell them is that it's non-invasive, it's not painful, and to stay still, and it takes little time. Okay. So you go and teach the patient like kind of what it is, and then it's really important to stress that it's not painful and non-invasive. So this just helps them kind of just subside their fear.
The little time part, is this like little time to set it up or little time for it
to actually go, like I've seen them in the ER, they just like, because what they do is they take the leads, which are just stickers basically. Well, you can just tell the patient that, but they measure it. They just like put them on there. It takes like a minute and they're like, okay, sweet. And they take it off. So it takes a little time and they have to stay still for it because it could sway the results a little bit. And then also just know as a side note, telemetry is when it's continuous monitoring. So that's like patients on the cardiac floor. So the nurses have computers of constant monitoring of the strips so they can see what they would be, what rhythms they would be. So basically that's the main thing you want to know about it. So do you have any questions from 1 to 14?
Telemetry. So is it just related just to
just like,
or is it related to like all like monitoring like you have like a
oh, no, it's just for patients who are at like risk for MI,
okay.
Patients who have just weird heart rhythms, they're just going to monitor them. So like a patient who has a risk for MI, you can kind of detect when it's about to go into it, so you can prevent them earlier.
So it's only, like the word is telemetry is only used for
continuous monitoring.
Okay, so but for
what
all,
do you mean?
For all continuous monitoring or just?
Continuous monitoring of EKG.
Okay.
Yeah.
So it's not like if she has a pulse oximeter.
Oh no, it wouldn't be telemetry. Okay. That's a good question though. But yeah, so like patients in the cardiac floor who have that, you go call telemetry, and they kind of read the rate for you. So and they're on telemetry. That is a good question though.